Alright, in this video we are going to be talking about measuring range of motions, doing 4 specific ranges of motion. This is a useful tool for analyzing how far a patient has progressed in a rehab, and it'll help you compare measurements to past measurements and see just how far the patient has progressed. So, shouldn't feel any pain during this. We're just measuring your motion just to see how it's going. So the first motion that we are going to be doing is shoulder abduction. So you can have the patient either supine or standing. So we're going to put the axis is over the center of the humeral head on the anterior aspect of the shoulder. So right there. Next, we're going to put the stationary arm parallel with the middle of the sternum. So stationary arm is going to look like that, parallel with the sternum. And then lastly, the moving arm is in line with the medial epicondyle of the shoulder. So what I'm going to have you do is you're going to move your shoulder through that motion as much as you can. Go ahead. And that's how you would measure it, making sure that they don't compensate in any other areas. Second motion that we're going to be doing is wrist flexion. So the ideal position for this is you're going to have the patient have their wrist hanging off the table. So you could have them sit in a stool. Go ahead and sit in that stool right there. I'm going to position. Could you face the other way for me?
This way?
Yeah, that way. So you're going to have your wrist like this. We're going to measure that wrist. That's going to be off the table. Perfect. Reposition that. Awesome. So with wrist flexion, what we're going to be doing is having the axis over the center of the lateral aspect just by the ulnar styloid process. So that's going to be on this side. Next, we're going to have the stationary arm lateral with aligned with the lateral midline of the ulna, like so. And then lastly, the moving arm is going to be aligned with the 5th metacarpal. So basically what you're going to do for this motion is just come up like that whenever you're ready. Just like that. You can go ahead and sit back on the table as we reposition the camera. The third motion that we are going to assess is knee flexion. So the best way to assess this is have the patient lie on their stomach. So you can go ahead and lay on your stomach. You can go ahead and put your head on the other side for me. So, with knee flexion, you could have them lay prone or supine. For the purpose of this video, they're going to be lying prone. So first place, we're going to want the axis along the lateral epicondyle. So, right there. Next, we're going to put the stationary arm over the lateral midline of the femur. So find the stationary arm, like so. And then lastly, the moving arm is going to be along the lateral midline of the fibula, specifically looking at the lateral malleolus, making sure that it is in line there. So you're going to go ahead and bring your heel to your butt while I measure. Perfect, and then back down. Awesome. The last motion that we are going to assess is ankle inversion. So you can go ahead and sit up for me. Stay seated on the table with your feet on. Let's have them hanging off for me. Yeah. Yeah, that would work best. If I can get it to. Let's just do it on the table. That should work fine. All right. So for ankle inversion, what you're going to want to use is a smaller goniometer, like this. So the axis is going to be over the anterior aspect of the ankle between both the malleolus. So, like that. Next, the stationary arm is going to be over the midline of the tibial crest. Specifically, we're going to be looking for the tibial tuberosity, making sure that that is in line there. And then lastly, the moving arm is going to be along the 2nd metatarsal, which it is. And so basically what the patient is going to do is rotate their foot inward like so. Go ahead whenever you're ready. Perfect. And that's how you assess the range of motion for the 4 movements